So looking at the concept of center of gravity, so the center of gravity is basically a point of balance in the body. When you look at human beings, the center of gravity in most individuals is slightly anterior to the second sacral vertebrae. So if you look at the sacrum, it's slightly anterior to that. Now, we alter center of gravity with therapeutic exercise with the arms and at the side, at the head. So we could change this. You know, when you're looking at people of different body builds, their center of gravity could be very different. Obviously, in males, the center of gravity does tend to be even a little bit higher than that kind of contemporary point, just because of having more muscle mass in the shoulder girdle. But again, obviously, overall body build and structure is going to determine that. That's why you tend to see, like, a lot of NFL running backs tend to be a little bit shorter in stature, and a lot of times those that are a little shorter in stature tend to be a lot harder to tackle. They tend to have very good balance, and that tends to be what you see with that. Okay, in the case here, you're seeing a picture of the young woman. Her center of gravity is again at that typical point. In females, it will tend to be lower. But again, we can alter it and change it based upon how we stand. Obviously, for instance, if the woman in this picture were to put her arms over her head, that would then raise her center of gravity. If she were to squat down, do a squat and get into a squat position, her center of gravity would then lower. Okay, so again, it's gravity's force vector when we're examining that concept. Okay, so equilibrium. Okay, and this is important for when center of gravity is disturbed. So again, equilibrium is related to our balance, and there's three different types of equilibrium. There's stable, unstable, and neutral. Okay, so we have stable equilibrium. So that's when the center of gravity gets disturbed, but we're able to return to our normal position. Okay, so that would make unstable is when the body would essentially fall, because unstable equilibrium, the body falls, it's not able to return to its normal standing state. Neutral is when the body's displaced but remains at the same level. So, one example of that would be if, say you're driving in a car. This is kind of weird, but this would be an example of neutral equilibrium. So you're getting displaced, but your body never changes. So when you're driving your car, your body's actually moving, because obviously you're moving because you're in the vehicle, but you're staying at the same level the entire time. So again, what influences stability? So when we're looking at stability, and again, center of gravity plays a role with this. Okay. So again, one of the main things that there's a couple main things that influence it. One is the height of the center of gravity above the base of support. So we talked about this on the previous slide, where we talked about how, for instance, if the woman in the picture were to, perform a squat exercise, she's actually lowering her center of gravity relative to her base of support. So her base of support is where her feet are. If she lowers that, that's going to influence and actually make her more stable. The other thing that influences it as well is the size of the base of support. Okay, so if she were to take her feet wider and squat, that would influence her stability as well. The location of the gravity line within the base of support also influences that. So obviously, the closer that line of gravity is within your base of support, that's going to allow your stability to be better. And the weight of the body. So if the body is bigger, it tends to, or there's greater weight, that also makes things more stable as well. Okay. So in other words, so how can stability be enhanced? Okay. So we can lower the height of the center of gravity to make something more stable. We can increase the size of the base of support. We could center the gravity line within the base of support, and we could have greater weight to the body. All of that will influence and make stability be more enhanced. So if you were to look at this picture, okay, so an offensive lineman pass blocking. So, what makes what makes him so hard to move, or what makes it difficult to move him, okay? So if we look at, again, what's going to work optimally for stability, okay? So, you know, when you're pass blocking, there's a certain posture you want to be able to have. So he's not standing straight up and down, okay? What's he doing? He's kind of squatting down a little bit. So he's lowering his center of gravity. Now, he's got to be able to move, so he can't lower himself. You say, well, if lowering the center of gravity is gonna make him harder to move, he should just, you know, squat down as low as possible. Well, he still has to be able to move his feet. Okay, so he doesn't want to stand straight up. He's gonna lower himself as low as he can go to, you know, to maintain his ability to move. So he's got to be able to also, again, it's always a trade-off between stability and mobility. He's got to be able to be mobile too. You also notice his feet. He's not standing with his feet close together, right? He's kind of separating them a little bit. He's increasing his base of support, okay? In context with that, he's going to keep his line of gravity in the middle of that base of support, the base he can, as best he can. And he's a big guy. That also makes him hard to move, okay? You know, he's probably around 330 pounds. Okay, so all of those things make him difficult to move. So again, those are all of your factors when you're looking about enhancing, when you're looking at enhancing the stability of an object, looking at the combination between equilibrium, center of gravity, and kind of the factors that, you know, influence when we're looking at, you know, maintaining balance in a situation. Okay, again, equilibrium. So, you know, we look at the base of support, you need to consider the line of gravity. Okay, the more the line of gravity is in the middle of the base of support, the better off you are. The closer the line of gravity gets to the edge of the base of support, that puts your equilibrium kind of more, or it kind of puts you in a situation where you have a greater ability to lose your equilibrium. Okay, so the body is most stable when the line of gravity runs directly through the base of support. Okay, and again, the closer that line of gravity gets to the edge of that base of support, the greater chance you have of losing your balance. Okay, and that's where we look at large versus small base of support and activity. The larger your base of support, the better off you are. Now, again, there is a trade-off. And that's why, again, you could go back to that picture of the lineman and say, well, if just making his base of support makes him harder to move, he should just go as wide as he can. Well, the problem with that is if he goes too wide and, again, isn't able to move, that's going to limit his ability because he's got to move with. If he just has someone coming straight at him, well, yeah, then make your base of support as big as you want. But that pass rusher is going to be trying to move and take different angles. So, again, you have to also weigh the mobility aspect as well. Okay, levers and muscle activity. So again, what class of levers primarily present in the body? So I asked that question earlier, and I still want you to think about that. Again, muscles need more force to create movement or resist force. So again, we look at our main purpose is motion. Okay, so our main thing is motion and speed of motion. So when we look at that, in order to get these large ranges of motion, that's where the levers need to be present in order to do that. Okay, so speed and motion. So in order, you know, if you look at things like the soccer kick and the large range of motion, so look at the range of motion both at the hip and the knee, and that's to be able to bring that through. Okay, because it's, you know, yes, force needs to be produced, but in order to really get the optimal amount to that ball, you need the speed and motion to be able to produce the motion for that purpose. Okay, joint forces. So, you know, we look at joint reaction forces. So this is a combination of forces from muscles. So remember, we said, you know, we don't just have joint, you know, the stress on our joints just doesn't come from our body weight, okay? It comes from a bunch of different things. So we have the forces from muscle, we have the force from gravity, we have whatever external resistance there is, and we also have the friction that's present. So when we look at our joints, we have both distraction and compressive forces, okay? And again, you know, we need, in order for all our body tissues to be strong, they need to have stress imparted on them. So you know, when joints, for instance, get immobilized and they don't have forces on them, the cartilage actually deteriorates. So, you know, at the same time, the flip side to that is if you do have too much compressive force, the cartilage can also deteriorate for different reasons. So there's always an optimal amount of force. When we look at things like arthritis and even like things like patellofemoral stress, where there's that generalized pain behind the patella, a lot of that is going to be because of too much compressive forces. But our joints do need a certain amount of compression in order to maintain its health. Okay, that cartilage is going to atrophy if it's never given any sort of compressive forces. So it's important to balance that and consider that when you're looking at, you know, different stresses getting applied to the body. So the application of resistance to the body, again, the more distal the resistance, the greater the forces are increased. So that's something to consider when you're instructing individuals on exercises, particularly if you're talking about a joint that is painful or is recovering from injury. And you also have to consider the effect of gravity on the limbs. So the maximum torque on the segment is when it's in a horizontal position relative to the ground. If you look at this situation here, we're not so much looking at a resisted movement, but we're actually looking at a distraction movement. So again, you're looking at the force of gravity. So you have the weight of the arm plus the weight of the dumbbell. So he's basically doing like what would be called a pendulum exercise. And a pendulum exercise isn't necessarily a strengthening thing. It's actually a distraction force on the shoulder just to kind of get it to do some light motion. But again, if we look at the forces here in the applications of the resistance in this particular situation, you'd have the force of the weight of the arm plus the weight of the dumbbell kind of acting on it. So that's all the things you want to consider when you're looking at how resistance is getting applied to the body. You're looking at the application of pulleys. So pulleys are used in two different ways. They're actually used in both strengthening and in situations where you're applying traction to a limb. So in the case where, you know, there's different applications of the purpose of traction, or where you're trying to place a distractive force on a limb. But pulleys are used in both instances. So, and you have single pulleys and movable pulleys, okay? It's important to note, and you see this in the picture here. So in the case of the pulley here, and kind of when resistance is going to be at its greatest, so the resistance is greatest when the line of pull forms a 90-degree angle, okay? So when that line of resistance forms a 90-degree angle, which you see here, is when the resistance is at its greatest. So when you're talking here, this wouldn't be the case if you were just doing, you know, knee extension without any weight. But in this instance, this position right here is where the resistance is going to be the greatest and where everything is going to be directed at rotation. Okay. Now it's important to note, whenever you have what's called a single fixed pulley, there's no mechanical advantage. Okay. So with a single fixed pulley, you have no mechanical advantage. In other words, the weight is the weight. When you have what's called a movable pulley, where you have multiple pulleys within a system, you gain force, but you lose distance. Okay? So you basically need to move a greater distance in order to produce a relative amount of force. Now here's where you see that difference with the single versus the multiple or the movable pulley. So with this single pulley, this is what I was just talking about on the previous slide. There's no mechanical advantage. Okay, so this is a 10-pound weight. You need 10 pounds of weight to lift the object. Okay, so in other words, if you don't produce 10 pounds of force on this rope, this isn't going anywhere. Okay, whereas over here, okay, with this movable pulley, you'll actually gain a mechanical advantage. Okay, so you'll be able to produce more force relative to that, but the distance at which the end object is kind of moving isn't very far. So what they're doing here, this is actually traction. So many times, you know, in the case of long bone fractures in this instance, they may want to traction it to make sure that it's lining up well. So they're getting a good amount of force here, but again, the force comes at the expense of distance. So all of these ropes, so to produce that added force, this has to move a great distance. The relative distance here is not moving much with that. So again, you have to be able to see how different pulleys and how they work in different situations. We have anatomical pulleys in our body. Okay, so within our body we have pulleys. Okay, and the idea behind anatomic pulleys is to change the course of a tendon or improve mechanical advantage. So if we look, for instance, here, so look at the ankle and lower leg. Okay, the peroneus longus. Okay, we have a pulley here. If you look at the peroneus longus and how it tracks along the lateral malleolus. So what this means, so we know that the peroneus longus does eversion, but it also does plantar flexion. Now, if for some reason the peroneus longus came in front of the lateral malleolus or came anterior instead of being posterior, think about what that would do. It would still evert, but it would not be able to produce plantar flexion anymore. Now it would become a dorsiflexor because the line of pull would pull this way. So that's an anatomic pulley where you're actually changing the course of the tendon in order to produce a specific movement. In the case of the patella is strictly there to improve mechanical advantage. So if you look at the patella and what it does for the quadriceps tendon. So what the patella does is it increases that moment arm or increases the distance of the tendon of the quadriceps from the knee. What that does is it actually allows the quadriceps to have a greater mechanical advantage and be able to produce more force with knee extension. For instance, if we did not have a patella, you'd still be able to extend the knee, but you would be doing it with less force. Okay, so you look here at the knee with the patella versus without the patella, you notice that that distance increases. The tendon has moved further away from the joint. That's going to allow it to produce more force at the knee. So that's why the patella is such an important structure as far as the functional performance of the knee. Obviously, we know that it protects, one of the jobs of the patella is to protect the anterior knee joint, but the other job of it is to help improve the mechanical advantage with the quadriceps tendon. So we come back to that whole idea of the moment arm and the rotational advantage at our joints. And this was something I alluded to earlier. So to review a concept, remember we have two forces that are applied to our joints in the body. We have rotational forces, which is obviously the force that produces rotation. And we have the tangential forces, hopefully that all sounds familiar. And that's our compressive or distractive forces. So as we go through our range of motion, those forces are present throughout that range of motion. Remember, we said when the moment arm is at its longest, okay, and that's going to be when it's perpendicular to the joint, that's when all of the force is directed towards rotation. So if we're looking at that, here's where we're seeing that, okay? So here it's small because the distance is short, and here it's short. You're at 90 degrees here. That's when this moment arm going from the joint to the muscle insertion is at its longest. So in other words, at this point in the range of motion for the elbow, all of the force is getting directed towards rotation. That's not the case here, and that's not the case here. In this instance, okay, where you're at, let's say, let's estimate that to be about, let's say 30 degrees, okay? So when the elbow is at 30 degrees of flexion, producing force, so you're basically flexing the elbow from this point, yes, you have rotational force, but more of that force is actually getting directed towards compressing the joint, okay? So in other words, the force is coming from the bicep here. While there is a rotational component, more of the force is actually getting directed towards compressing the joint, okay? So you're getting greater joint compression. When you get over here, where you're, say, at, let's say 120 degrees of flexion, or, well, maybe a little bit more than that. Let's say 130, 140, okay? And you're producing force. More of those forces are now being directed towards distracting the joint, okay? Now, typically a lot of times is that, students will say, well, if there's distraction forces, how do we not pull all our joints apart? Well, when you're at this point in the range of motion with the elbow and you're trying to produce more force, you can't produce enough force to tear the joint apart, okay? So yes, there are distraction forces, but you're never going to distract your joint and pull them apart because you can't produce enough force with the bicep when your elbows flex that much. Remember, all your sarcomeres are taken up. You can't produce as much force, okay? So again, everything directed towards rotation here. Greater compression forces here, greater distraction forces here. Okay, so again, this is where you want to look at, again, and why is this important? Because we have to know that, you know, with muscles, the changes in the moment arm and the distance from the joint affect how much force is getting produced. Okay, stretching versus joint mobilization. So this kind of comes back to a concept related to, you know, clinically some of the things we look to do when we're trying to mobilize, say, soft tissue around a region. And there's a difference that you're getting when you're doing stretching versus joint mobilization. So first of all, stretching typically utilizes a large lever arm, okay? So this provides a mechanical advantage. However, it does increase stress at the joint. So think about, you know, when you're trying to, say, stretch a hamstring, you know, how do you usually stretch someone's hamstring? You usually go to the distal part all the way down by the ankle and foot, and you flex their hip. So you create a large lever arm, okay, which gives you a mechanical advantage. However, it's also going to increase stress at the joint, okay? Now, you know, in the case of they have a healthy joint, you're just trying to stretch the hamstring, that's perfectly fine. Doesn't necessarily have to be, you know, we're not necessarily viewing stress per se as a bad thing, unless, of course, they have a major hip issue at the joint, and that would be a problem. That's different from mobilizations, which are based on arthrokinematic principles. So if you go back to those arthrokinematics that we talked about in the previous chapter, and essentially what joint mobilizations look to do is relieve pain and also restore motion from an arthrokinematic standpoint. So they look to address the roll and slide that occurs, okay? Again, the direction of movement is going to follow the normal arthrokinematics. The magnitude of the force is going to be controlled, and the motions are going to be much smaller than you do with stretching. And ideally, you're actually going to look to apply the forces closer to the joint. Okay, so you're going to use shorter lever arms in order to do that, and really you're not going to get a whole lot of motion. Relatively speaking, you're not getting as much motion when you're just doing, you know, joint arthrokinematic motions as you would with the osteokinematic motions that you would be producing with stretching. Okay, so looking at the concept of pressure. So part of what we look at with biomechanics is, and we look at stresses and things like that, and what some of these things mean. So when we look at the concept of pressure, okay, as it relates to forces. So that's the force applied per unit area. You know, you'll commonly hear PSI. So something is so many PSIs. That's your pressure, okay? So now our bodies actually respond to normal pressures with what we call functional hypertrophy. One of the most common ways to see that is when you look at your feet. You know, your feet will get calluses formed on them, and that's from normal pressures being applied to the feet. If you have somebody that has an abnormal walking gait, you'll see calluses in areas where they probably shouldn't have them based upon a normal walking gait. You know, individuals who strength train or do a lot of manual labor with their hands will develop calluses. And again, what that is that's just the body kind of responding to the pressures at the skin, basically causing that hypertrophy of that layer of the skin. Okay. Another important thing to note, that time is also a factor. So the time in which pressure is applied is also important. So, you know, you can have a bunch of different things. And, you know, and we look to actually decrease pressure as a way to limit stress a lot of times. So the three ways we can decrease pressure is, one, you can decrease the actual force being applied. You could increase the area of application, and I'll show you in the pictures here how we do that, or you could decrease the time of application. So if you look at what's happening here, so first of all, if you were to look at each one of these, so I normally ask this question in class, what would you, if it were you, which one do you think would be the easier thing to tolerate, getting tackled or getting punched? Most people would say, well, I'd rather get tackled here. Why? Because while there's a lot of there's a lot of force being applied here, it's also distributed over the body. So you're actually lowering the amount of force being applied, because it's being applied throughout the body, whereas here it's a very focal amount of force. So there's while it's just a fist kind of hitting somebody, it's also very concentrated. So again, we talk about ways to decrease pressure. How do we do that? We're actually doing that here with pads, where we increase, pads are put in place to increase the area of force application. So by him wearing pads, that's actually dispersing the force over a larger area. It's actually happening here a little bit too. That's why they're not using their bare fist. They're using padded gloves, because that at least helps to disperse things a little bit. Okay? So again, 3 ways to decrease pressure. We could decrease the force, we could increase the area, or decrease the time. Okay? Because even a small amount of pressure, if applied for a long period of time, can also be a problem. If you think about pressure sores and bed sores in people who are on bed rest, well, why do they get these sores and pressures? It's not because there's a large amount of forces. It's because they're laying in one spot for a long period of time, and what's happening is the circulation and everything to the area is getting inhibited, and that's where you get things like bed sores in people, okay? So don't think of pressure as only being a problem when there's a lot of force. If you have a low force for a prolonged period of time, that can also be a problem. Okay, so that's something to keep in mind when you're talking about pressures. Okay, loading. And, this is something that your textbook doesn't directly address, but I felt when we're talking about kinetics that I wanted to address it in context. When we're talking about loading on a body or on any type of material, so strength is the ability of a material to resist deformation and shape. Okay, so if we look at all these shapes in this picture, okay, the dotted line represents where they started, and then the solid line represents where they kind of ended up once these stresses, which are the outside force, gets applied. So here we have a stress coming down this way. So here's the initial shape of the object. We have the stress, and we'll talk about what each one of these stresses are. You have the stress coming in this direction. Now it's shaped like this. Here was the initial shape of this object. Here's your stresses. Now here's the new shape. This was the initial shape of this object. You have a stress, and now it's shaped like this. So strength is the ability to resist the shape. Strain is the change. So that change in shape is the strain. Now in this picture, we have 3 different types of stresses. We have a compressive stress, we have a tension stress, and we have what's called a shearing stress. Okay? So here's our compressive stress. So what's a compressive stretch? In the case of a compressive stress, that's when 2 or more forces act along the same line of application. So you're saying here, sitting here saying, well, there's only one stress. Don't forget, this is, the objects in contact. Let's just say this is the ground or whatever. So here you have your force. What that's doing is causing the change in shape in this direction. So a compressive force is when 2 or more forces act along the material along the same line in opposite directions. Now, in this picture, you're only seeing this, but don't forget it's in contact with this surface, so technically you're also getting a compressive force this way as well. It's just not moving, okay? A tension stress, this is what we're looking at here, is when those forces are acting in opposite directions. So you have 2 forces acting in opposite directions, causing, in this case, a lengthening of the shape, and that's usually when you talk about tension, you talk about a change in length from that perspective. And then down here, we have shearing stresses. So shearing stresses act in opposite directions. So we have a stress acting this way, we have a stress acting this way, okay? So all of these types of stresses, okay, all act on some type of body or material and will change their shape or cause strain, and the amount of strain will be based upon 2 things. What's the magnitude of the stress, and what's the strength of the material? Okay, so the material strength, whatever it is, along with how much force will dictate how much the change in these various shapes are. So in this picture, so again, let's apply this to the body. That's what we're looking to do. We have tissue response to loading. So we have 3 different pictures here, and we have 3 different responses. Now, in all cases, we're looking at injuries. We have up here, we have an ACL tear. Here we have an ankle sprain. Here we have a vertebral body fracture. And we're showing in the picture, at least in these two, now you could assume in this picture where the stresses are coming from here. But if you look at these 3 things, what I want you to think about, what are the forces, what type of loads, where do we have compression, where do we have shear, and where do we have tension forces? Okay? So I want you to just think about that a little bit. Again, we'll discuss this further in class, but what are the 3 forces present here when we're looking at the tissue response to loading? So another thing we look at is what's called an axial load. So axial loads are anytime the loading is along the axis of an object. Typically, what we see with this are a combination of different types of stresses. So if we look in this picture of an axial load, so an axial load again goes along the axis of the object. So in the case of the spine, you have a load coming down this way that's considered an axial load. You actually have 2 different types of forces occurring at the tissues here. So if we were to look at the disc, okay, so here's your intervertebral disc. This is obviously the spine. You know, here's your spinal cord, here's your vertebrae, and you know, let's just say these are lumbar vertebrae. They look like lumbar vertebrae because they're pretty big and thick. You have an axial load. So obviously we have a compressive force, right? But you also have tension forces. So you have compression forces on the disc, but you also have tension forces on the fibers of the disc. So while you have the force coming down here, kind of compressing the disc, you also have tension forces here, because as that disc is getting pressed down, the tension forces are putting stress on the outside, which that's then what causes the, as you see in this picture, the case of this, you have the herniation starting to occur. So you have the on the concave side, you have the compressive forces coming down. You also have the tension forces along the periphery of the disc that would cause damage to those structures. So when we're looking at different anatomical regions of the body and the forces being applied to them, we have to consider multiple forces and how that can possibly affect the tissues in different ways. Okay, the force of bending. So again, anytime you have the long structures or a beam, you could have bending forces. And what you have to look at there as far as the stresses are concerned are the concave and convex sides, because that tells you where the forces are being applied, okay? And again, the stresses are going to be maximal at the outer surface of the beam or the long structure. So when we're looking here, okay, there's going to be what's called the neutral axis. So this is a bone. Now, our bones actually do bend. For instance, when we look at the lower extremity, our lower leg, we actually do have bending forces that do occur, which for the bone is good. It's always good to stress bone a little bit because that causes it to remodel and be strong. Obviously, if you don't allow for recovery and things like that, that's bad. You can end up with micro trauma and stress fractures. But, you know, in the case of a long axis of the bone, you get bending. So you have a concave and a convex side. On the convex side, when you have bending, you have compressive forces. So the tissue on this side is actually compressing. The tissue on the concave side is actually getting pulled apart. Okay? So, you know, if you take a pencil and you start to bend it, okay, think of just bending a pencil even. As you kind of bend that pencil, you're putting tension forces on what would be the convex side, and on the concave side, you're actually compressing it, okay? Now, again, the stresses are maximal the closer you go to the surface. So the most tension surfaces are here, the most compressive forces are here. The closer you get to the middle, you're reaching what's called that neutral axis. That's where the stresses are applied the least, okay? So again, most of your tension forces will be directly on the outer surface, again, out here on the convex side, and more of your compressive forces will be here on the concave side. So again, let's apply this bending concept to, we kind of showed it with a generic bone, but where could that come into play when we're talking about an actual injury or situation within the body? So here we're looking at the hip, okay? And what we're looking at here are femoral neck stress fractures, okay? So femoral neck stress fractures are obviously a pretty significant injury. However, they could be handled very differently depending upon whether they're on the compressive side or the tension side. Now you sit there and say, well, why would that make a difference? So let's not look at the displaced one yet, but when you have a stress fracture on the inferior part of the femoral neck versus one that's on the superior part of the femoral neck, these are handled both very differently, okay? This person goes non-weight bearing on crutches for a set period of time. This is an emergency and needs surgery. So you sit there and say, well, why would one type of stress fracture only require conservative treatment and non-weight bearing and one be an emergency? Well, think about what happens when you have one on the inferior side versus the superior side. This is going to be a compressive force that does this. So meaning the bone isn't going to become unstable. There's still a fracture and this is still a problem, but it's not going to become unstable because it's the compressive side of the bending force. If the femoral neck is going to experience a stress fracture, it's going to be because of a bending force. This isn't unstable, whereas tension, again, go back to what tension is. Tension is when you have forces going in opposite directions. So what that means is on the superior side, again, it's still going to be a bending force, but if that breakdown occurs on the superior aspect of the femoral neck, that's going to cause a distractive force. Because remember, if we're just talking about the femoral neck getting, bending, okay, now that's getting pulled apart. That's why when you talk about femoral neck stress fractures, if it's suspected that somebody has a femoral neck stress fracture, they need to have it looked at as to determine whether it's on the inferior side or the superior side, because they're handled very differently. And the reason for that is because, again, it's a bending force. If it's on the inferior aspect, it's compressive. That basically means it still needs to heal, but it's stable. If it's on the superior aspect, that means it's going to be a tension force. That means it's going to be unstable, and then it could progress to the displaced, as you see in the picture. So we look at the concept of bending. Now we're going to look at the aspect of torsion, which is a twisting action. Okay, so torsion is a twisting action. So if you look at that object and we just kind of twist it in place, that's going to be considered torsion. Okay. And again, you're going to have multiple forces taking place here. You're going to have tension, you're going to have compression, and you're also going to have shearing forces. So when you're kind of producing this twisting action on material, you're going to end up with both tension, compression, and shearing, okay? And there's going to be a clockwise force on one end and a counterclockwise force on the other. The resistance to this is going to be what we call the polar moment of inertia, so that the object's ability to resist the torsional force is going to be what's called a polar moment of inertia. And again, factors related to torsional loading. The larger the radius, the more difficult it's going to be to deform. So if we look at this object, so we look at the radius. So the radius is measured from here to here. So basically how big this is, obviously if this object, whatever it would be, this cylinder-shaped object, if it were thicker, it's going to be much harder to deform with a torsional force than if it was smaller. The stiffer the material, as would be with any substance, the more difficult it is to deform. So if you just look at material, we look at the body. Okay, bone is more difficult to deform than ligament because bone is stiffer. Okay, is stiffer material. And then the helical stress trajectory. So what that means is, again, much like the bending force, the outer surface of the structure is going to be more prone to being changed because of the stress versus the inside. Okay, so in other words, the outer surface has greater stresses to it than others. Again, let's go back to the body because it's kind of hard sometimes to see this being placed on just kind of made up shapes and objects. So torsion, okay, so spiral fractures, okay, spiral fractures as they occur. Okay, so again, if there's a torsional stress on the bone, you can get what's called a spiral fracture. You get spiral stress fractures, and you can get full fractures occurring because of that. Over here, this is if you end up with a torsional force at the ankle, so we know you could get what's called a high ankle sprain if the foot is kind of planted and there's an external rotation force. You could damage those ligaments. If that force continues or gets larger, you end up with what's called the Mason-U fracture, where you basically get that whole syndesmosis tears and it actually goes right up into the proximal fibula. So, again, a high, what we call a high ankle sprain will happen because of one of two mechanisms, and one of those mechanisms is an external rotation force at the ankle. If that external rotation force is big enough, it will continue to cause damage straight up the syndesmosis to the point where it will cause a fracture at the fibula. Those of you that know in football, the horse collar tackle rule was put into place after, if you remember going back to when Terrell Owens got injured when he played for the Eagles. This was the injury that he had, and it was because he got pulled down from behind by his shoulder pads with his foot placed. So if you think about all that force, if again, a light amount of force would have just caused a high ankle sprain, which is still an injury that requires a little bit more attention than a regular, lateral ankle sprain. But he had so much force because he had the weight, a 235-pound safety pulling him down, that caused that increased stress. So this is a torsional stress injury, as is this at the upper arm. Okay, again, learning outcomes, which you can review. So again, the kinetics looked at, again, so kinematics looks at motion, just describing it, not worried about the forces. Kinetics looks at the actual forces, and then we look at not only forces, but how forces affect objects, affect materials, and in the case, again, what we commonly deal with, how they're going to affect the body.